So this next question is also a delegation question, but it's formatted differently. So a lot of the delegation items you will see are formatted to just say which task is appropriate for delegation. But we've also seen that NCLEX uses this type of formatting, which is a little bit different, and I think it's a little easier to get confused on. So let's look at the stem and the question really carefully. It says the charge nurse is supervising an RN in the care of a client with hypertension. The charge nurse should intervene if the RN asks the UAP to do what? So basically, this stem is asking us to identify inappropriate delegation or an unsafe delegation request. And I know y'all are already guessing the answer, so let's see if y'all are right. So option 1, document the client's blood pressure and heart rate every 8 hours. So if we are asking a client or asking a UAP to document blood pressure every 8 hours, that is a routine task, and it appears that this client is stable. There's nothing to indicate this client is unstable. So I think that that would be safe to delegate. And remember, we're looking for something that is unsafe to delegate. Option 2, report a systolic blood pressure level below or above specific pressure. So that's basically saying, hey, can you please go check this blood pressure and let me know if the systolic blood pressure is greater than 130 or less than 100. It's giving very specific parameters. I think this is appropriate, and if I was that charge nurse, I would be like, kudos to you, RN. You just did an amazing job communicating. So I think that that is very appropriate. So all of you guys are wanting option 3. And Mighty Mike, you said it's because it's teaching, and I agree. So once again, carvedilol, showing the client the correct way to measure a pulse before taking carvedilol. We know carvedilol is what kind of medication? That LOL at the end should give it away. It's a beta blocker. And we know that even though it's given for high blood pressure to reduce the blood pressure, what other vital sign is it going to affect? Besides blood pressure, what else is it going to affect? Heart rate. So remember, if we always, NCLEX tip, you know, with beta blockers, we're always checking the pulse before we give a beta blocker, because if their heart rate is low and we give it, we can cause life-threatening bradycardia. So can anybody tell me, as a bonus question, what heart rate would make me want to hold a beta blocker? So if I was assessing a client and I saw this heart rate, which one would make me say, oh, I'm not giving this medicine? What's usually the cutoff? Anyone tell me, what heart rate should I be concerned about when given a beta blocker? And once again, my chat is delayed, so y'all can see each other's comments before I can. So the answer is 60. Very good, Cassie. So if you see a heart rate of 60 or less, we are holding that medication. So we always need to teach our client that as well. We need to teach them when they get home how to check that pulse and to hold the medicine if the heart rate's less than 60. So far, I think 3 is going to be inappropriate delegation because it's client teaching. But let's look at option 4, because I saw a couple people did choose it. So option 4 is measure orthostatic vital signs supine, 3 minutes after sitting and 3 minutes after standing. So just to refresh everyone's memory, orthostatic vital signs is assessing a client's blood pressure and heart rate when they're lying down, after they've sat up for a couple minutes, and after they've stood for a couple minutes. And what we're doing is we're looking for big fluctuations in the blood pressure and the heart rate that could indicate fluid volume imbalances like dehydration or other issues. This would be appropriate to delegate to that UAP as long as they understand how to do it. And we gave them very specific instructions saying, check it when they're lying down, 3 minutes after sitting, and 3 minutes after standing. So I think that that would be appropriate. And I agree with you guys that option 3 is best.